Beltway. Today we're in Pittsburgh, but joining me now, the one and only Dr. Peter McCullough, my favorite doctor in the history of the globe, of the world. What a great guy this is. He's so brilliant. You know, he was the first one. You know, he risked everything. This guy, he risked everything in order to get us the truth. And he's been banned. He's been this. He's been that. And they wanted to pull his license away. And I always tell my son, good luck. You're not pitching against Dr. Peter McCullough because the guy's batting 1,000. He's like the Ted Williams of medical. The guy's batting 1,000. He's been right about everything. You can't pick a thing. Okay, let's find something McCullough was wrong on. Nope, can't. He's batting 1,000. And he's joining us now. He's also the head of the founder of the wellness company. It's my favorite medical company. It's changing the way you do medicine. Dr. McCullough, thanks for being with us. I want to get right to it here. Explain the arguments in front of the Supreme Court on transgender hormones and surgery safety. Peter, what is going on with this?
Supreme Court heard last week a case brought by the Biden administration, specifically Assistant Secretary Richard Levine, who is a pediatrician who lives out his sexual fantasy as Rachel Levine. And he's bringing a case to try to tear down the Tennessee ban on transgender hormones and surgery for kids under the age of 18. We have a similar ban in Texas by Attorney General Ken Paxton. In fact, 25 states have the ban. And the arguments that Biden administration is bringing is that this is discriminatory and that these individuals need this health care, that it's essential to their existence. The counter arguments, and I assisted Ken Paxton in Texas, on the counter arguments on this, John, and as a doctor, I know this to be the case. The hormones, puberty blockers, androgens and estrogens, and then these surgeries, removing the breasts of normal breasts of girls and the altering the penis and removing the testicles in men, that this package of transgender care increases the burden of psychiatric disease. Most of these kids have autism at baseline, so it makes things much worse. It is sterilizing, disfiguring, and increases mortality from all causes. So across the board, transgender medicine is bad medicine. And from a biomedical ethical perspective, it should be banned nationwide.
I mean, it's just horrific what we're going through here with this nonsense. Now I get back to COVID. So explain the Biden extension of the emergency declaration, which is a disaster to begin with, for COVID-19 through not 2025, not 2026, 2029. I mean, what is the deal with this?
How can the Biden administration possibly know the vaccines were safe or are going to be safe as they continue to be administered and changed through 2029 and the cumulative toxicity? Essentially, what Biden has done with the vaccines is he's given them a pardon. He's given them basically a limitless, liability-free pardon. He's considered actually giving Anthony Fauci a preemptive pardon. This is prima facie evidence. These vaccines were never safe. The government now is trying to, cover their bases from an avalanche of product liability suits that will come in all different varieties. No matter how much liability protection is there, the government is liable in substantially encouraging and then ultimately mandating people to take these COVID vaccines, which were proven to be unsafe and ineffective.
Well, now we've got we've got a federal judge directing the FDA, which is another thing that's got to get cleaned up, total corrupt, to disclose. Get this. I mean, I just can't make this stuff up. You would think you're on the Onion, right? Like you're on like the Onion right now, or like the Babylon Bee, right? 1 million more pages. 1 million pages. I don't even know how many that is. It's stacking to the moon. 1 million more pages from Pfizer's COVID vaccine trial documents. 1 million, not 10 pages or 1,000 pages, 1 million. You couldn't read that in 7 years. What the hell is that about?
The only way a product like the Pfizer vaccine could generate 1 million pages is if it was creating hundreds of millions of side effects and injured and damaged people. That's the only way, John. It's been a disaster. I saw a man in my clinic this week who had taken 6 Moderna vaccines, 6. And on the 6th one, he had a generalized seizure. His heart went into an abnormal rhythm. He was hospitalized. He nearly died. And he finally learned. He said, the government told me these were safe. I kept taking them to try to protect my family. And people sadly are now learning. The COVID vaccines are not advised for anyone. The pandemic is essentially over. If someone gets COVID, which they can, it's easily treatable. I hope people can understand that each shot brings on more and more toxicity to a tipping point, like what happened in that man.
So, yet you put the TV on and you've still got Pfizer ads or other ads encouraging new mothers to give their infants COVID vaccines. And this is paid for by, state and local government actually paying for the TV ads for this, backed by Pfizer. Why would you do that?
New Zealand and the United States are the only countries that have direct-to-consumer advertising. And with the vaccines, it's been so bad that the CDC and the Public Health Service are the government's doing the advertising for the vaccine companies. And in New Zealand, it's the Ministry of Health. Now, in both countries, there's movement to actually ban direct-to-consumer advertising, including government, agencies working as advertising firms for the vaccine industry. It's confusing. Quietly, doctors know these vaccines aren't safe. And if it was between doctors and the patients right now, most of my patients say, listen, they haven't taken a shot since 2021. Everybody quietly knows they're unsafe. And I think direct-to-consumer advertising should be banned, and hopefully that'll be done under Trump.
How's your relationship with RFK Jr.?
Have a great relationship with RFK. I'm strongly supporting him for his confirmation. And I believe he's going to bring a whole new, fresh set of ideas. John, I don't know if you know this, but RFK has raised concerns regarding safety of the food and water supply, and particularly in food, on these dangerous dyes that are out, food dyes that are outlawed in Europe and other countries. And now recently, the Biden administration has said, they're going to remove these dangerous food dyes even ahead of the Trump administration moving in office. And it's just a sign that RFK is making America healthy again. Just his influence is changing policy.
One of the things about your company, the wellness company, is you have changed medicine. You really changed the way you look at it. I've got 2 of these, which I just got this replenished, my medical emergency kit, one that I travel with, one that I stay at home. I've got one. My older son's got one, and my ball player has one. I haven't been to a drugstore in 12 months. I've replenished it 3 times. We've used this 11 times in 12 months, 11 times. I call up my doctor, Dr. Brandon. He's not available. My second doctor is Kelly Victory. They get back to me, FaceTime. Ann's been sick. Joe threw his back out playing golf at Cape Cod and couldn't get out of bed at midnight on a Sunday. I would have to drive 2 hours. 11 p.m., they're calling me back. Try going to a doc in the box. You're going to wait in line. Try going to an emergency room. They've turned it into basically free healthcare for illegals. You can't get there. Drugs are disappearing. I've got my ivermectin. I've got my hydroxychloroquine. I had a cold the other day. I had to get on the air. I was filling in for Gruber. I call up Dr. Brand. He's like, dude, just take this ivermectin. Do it now. Here's a prescription. Done. I just opened up and stuff. So really the new way to do medicine. And every family should have one of these. It says medical emergency kit, but it's not really for an emergency. It can be, but it's just for your day-to-day living. And all you have to do is go to twc.health, twc.health/Godzilla, twc.health/Godzilla, promo code Godzilla, 10% off. You guys are changing medicine, and I'm a big believer in it because I've utilized it 11 times in 12 months. It works, my whole family. So I just want to thank you for that. Brilliantly done, sir. And I want to thank you for all you do. And Hope that your relationship with RFK remains strong, because it tells you what one man can do when he believes in something. One man with courage. Dr. McCullough is a majority. Thank you for being with us today, Doctor.
Thank you.